Hello everyone, welcome back to my channel. In this video, I will be discuss about the mandibular nerve. Mandibular nerve is the largest branch of the trigeminal nerve. This is the nerve of first brachial arch. It is a mixed nerve, so it has two roots. One is sensory, other is motor. The sensory root derives from trigeminal ganglion and the motor root arises from pons and passes below the ganglion and the sensory root. Both roots emerge to the foramen ovale and immediately below it both the unites to form the single trunk. The trunk intervenes between tensor villi palatine on the medial side and lateral pterygoid on the lateral side. After a short course, it divides into small anterior and large posterior divisions. Now the branches of mandibular nerve. From the main trunk, we have meningeal branch, nerve to medial pterygoid muscle. From the anterior division of the trunk, we have sensory branch, that is the buccal nerve, motor branches to masseter, temporalis and lateral pterygoid muscle. From posterior division, we have auriculotemporal nerve, lingual nerve and inferior alveolar nerve. Now, we will discuss them in detail. Now the branches from the trunk, first is meningeal branch, also known as nervus spinosus. It enters the skull through foramen spinosum along with middle meningeal artery and supplies the dura mater of middle cranial fossa. Second is nerve to medial pterygoid. Few fibers pass through the otic ganglion without interruption and supplies the tensor tympani and tensor villi palatine muscle. So in the diagram we can see this is the nervus spinosus and this is nerve to medial pterygoid. Now the branches from anterior division. First is the masseteric nerve. It emerges through the mandibular notch in company with masseteric vessels and supplies the masseter muscle from its deeper surface. It also supplies TM joint. Second is deep temporal nerve. It supplies the temporalis muscle from its deeper surface and it is usually 2 in number. Other is the nerve to lateral pterygoid, which is supplying to the lateral pterygoid muscle. The fourth branch is the buccal nerve. It is the only sensory branch from the anterior division and it emerges between the two heads of lateral pterygoid muscle and supplies the skin and the mucous membrane of cheek related to buccinator. So this is the line diagram of branches of mandibular nerve. Now branches from posterior division. First is auriculotemporal nerve. Auriculotemporal nerve arises by two roots which encircle the middle meningeal artery. Then it ascends behind the superficial temporal vessels and enters the temple where it divides into superficial temporal branches. It provides following branches of distribution. First is auricular branch, which supplies the skin of tragus, adjoining part of auricle, roof and anterior wall of external acoustic meatus and adjoining cuticular layer of tympanic membrane. Second branch is superficial temporal branch. It supplies the skin of temple. Third is the articular branch to the temporomandibular joint. Second branch from the posterior division of mandibular nerve is inferior alveolar nerve. It conveys both sensory and motor fibers. It runs downwards and forwards between the ramus of mandible and sphenomandibular ligament and enters the mandibular foramen. It is accompanied by inferior alveolar vessels. Within the Ponican arc, it divides into incisive and mental nerves. So in the diagram we can see the terminal branches of inferior alveolar nerve. Now distributing branches of inferior alveolar nerve, these are to the molar and premolar teeth and the adjoining gum. It provides branches to canine and incisor teeth and the adjoining gum. It provides mental nerve which supplies the skin of chin and the lower lip. It is giving mylohyoid nerve, which is a motor nerve. It arises from inferior alveolar nerve before its entry into the mandibular foramen. It runs downwards and forwards in mylohyoid groove and it supplies mylohyoid muscle and anterior belly of digastric muscle. So in the diagram we can see the nerve to mylohyoid and the inferior alveolar nerve. The third branch from the posterior division of mandibular nerve is the lingual nerve. Lingual nerve lies in front of inferior alveolar nerve between lateral pterygoid and tensor villi palatine muscle. Then it comes in contact with mandible medial to third molar tooth. Here it is palpable against the mandible about 1 cm below and behind the third molar tooth. Branches distributing and receives the general sensations from anterior to third part of the tongue and the floor of the mouth. So in the diagram we can see this is the lingual nerve. It provides communicating branches to the chorda tympani nerve and submandibular ganglion on the hyoglossus muscle. Through this communication, lingual nerve conveys secretomotor fibers to the submandibular and sublingual glands and taste sensations from anterior to third part of the tongue. Now we come to the otic ganglion. It is a peripheral parasympathetic ganglion which supplies secretomotor fibers to the parotid gland. Topographically, it is connected to the mandibular nerve, but functionally it is connected to the glossopharyngeal nerve. Now, size and situation. It is 2 to 3 mm in size and is situated in the infratemporal fossa just below the foramen ovale between mandibular nerve on the lateral side and tensor villi palatine muscle on the medial side. Now the connections. It has a parasympathetic or motor root which derives from the lesser petrosal nerve. In the diagram we can see this is the lesser petrosal nerve. Preganglionic fibers arises from the inferior salivatory nucleus which is lying in the medulla. Here we can see, and pass successively through the tympanic plexus and the lesser petrosal nerve and then relay in otic ganglion. Other is a sympathetic root which derives from the nerve plexus around the middle meningeal artery. The sensory root derives from auriculotemporal nerve and the motor root derives from the nerve to medial pterygoid. Now the branches of otic ganglion, these are postganglionic parasympathetic fibers which are arising from the ganglion join the auriculotemporal nerve and provides secretomotor fibers to the parotid gland. Then the postganglionic sympathetic fibers, they are also passing uninterruptedly through the ganglion and provide vasomotor supply to the parotid gland. The fibers supplying medial pterygoid muscle pass through otic ganglion without interruption and supplies to tensor villi palatine muscle and tensor tympani muscles. This otic ganglion is connected to the chorda tympani nerve and nerve of pterygoid canal. This connection forms alternate route of taste from anterior to third part of the tongue to the genicular ganglion of the facial nerve. So in the diagram we can see this dotted line is showing the alternate path of taste sensations from the anterior to third part of the tongue. Now the clinical aspects. First is the referred pain. In case of tongue, that is in cancer of tongue, pain radiates to the ear and the temporal fossa. Over the distribution of auriculotemporal nerve, as both the lingual and auriculotemporal nerve, they are the branches from mandibular nerve. So referred pain is because of common nerve supply. Next is the lingual nerve lies in contact with mandible just medial to the third molar tooth. Then the third one is inferior alveolar nerve. As it travels the mandibular canal, it can be damaged by the fracture of mandible. So this completes our topic, the mandibular nerve. Thanks for watching.